Video number 3 is case study number 3, 30-year-old female complaining of knee injury during soccer game. She is weight bearing with continued significant pain. What specialty knee exams would you like to perform? There are a few knee exams that I'd like to perform. One is the McMurray test, and this is used to detect the torn medial or lateral meniscus. When you're performing this test, any palpable or audible click or pain or limited extension of the knee is a positive sign for a torn medial meniscus. What you want to do on this one is you want to repeat the test, but this time rotating the foot and the knee inward, the varus stress, and any palpable or audible click or pain would be a positive sign for a torn lateral meniscus. Another good test would be the Lachman test. This is used to evaluate the anterior cruciate ligament integrity, and when you're doing this test, you're going to stabilize the femur and pull the tibia anteriorly and attempt to have the patient relax their hamstrings. This will help in doing this test. But any increased laxicity greater than 5 millimeters compared to the uninjured side indicates injury to the ligament or the integrity of the ACL. Another good test would be the abduction and adduction stress test. And these are used to identify the instability of the lateral and the medial collateral ligaments. So when you're applying varus force with internal rotation, any laxicity in this position indicates injury of the lateral collateral ligament. Now if you apply a valgus force against the ankle and turn it midline and external rotation, any laxicity in this area would indicate a medial or collateral ligament injury or tear. What are considerations for x-rays versus MRI? X-rays, obviously any gross or obvious deformities. The other thing that works well for x-rays in that determined for radiographs is using the Ottawa knee rules and for injuries, very similar to ankle injuries. So the rules really include the following: anybody over age 55, tenderness at the head of the fibula, isolated tenderness of the patella, or the inability to flex the knee at 90 degrees. So any one of those symptoms there would be indicative of getting a radiograph or an x-ray of the knee. I would start with an x-ray of the knee with those, and then a ortho consult follow-up. If there's no neurovascular issues, numbness, tingling, paralysis, pallor, color changes, temperature changes, circulatory issues, pedal pulses, cap refill in the toes, if none of those issues were there, then I don't think there's an ER consult needed, but we can get the x-ray and an ortho consult following up that. Thank you.